This is the Brown Emergency Medicine April Case of the Month by Eric Lash, one of our interns. This case was a 32-year-old female who came into the emergency room. She presents with nausea, vomiting, and abdominal bloating. Her last menstrual period was over 2 months ago. An office visit about a month ago for a likely miscarriage was what she was told. At the time, she was having vaginal bleeding, and she had an ultrasound which showed a gestational sac, or what they told her was a gestational sac, but no yolk sac or fetal pole. And it was assumed or presumed at the time that she was having a miscarriage. Shortly thereafter, the vaginal bleeding stopped, but she continued having nausea, vomiting, which progressed over the past few weeks. And she came into the emergency department complaining of an inability to tolerate PO. At this time, the patient got a transvaginal ultrasound looking for an intrauterine pregnancy, and this is the image that was acquired. You can see there's something within the uterus with multiple cysts, and you don't visualize anything that appears like a gestational sac or anything like an embryo, just some cystic structure within the uterus. Another image that was acquired with the transvaginal ultrasound showed a lot of increased color flow or vascularity to whatever this structure was in the uterus. So what did this patient have? This patient had a molar pregnancy. So common symptoms with a molar pregnancy are going to be nausea and vomiting. These patients tend to have a very elevated beta-HCG. This patient's was almost 700,000. The ultrasound will show what looks like a snowstorm appearance or a bunch of grapes, which is multiple cystic structures within the uterus. So there'll be no fetal parts. In other words, you're not going to see an embryo or a fetus. In addition, you're not going to see any amniotic fluid. Basically, what you're looking at is a very thick cystic placenta that's filling up the uterus, and it's going to have increased vascularity. So what does an intrauterine pregnancy look like on ultrasound? Just to review, an intrauterine pregnancy on our ultrasound, you're going to see a gestational sac, which is a round anechoic structure. But to call it an intrauterine pregnancy, you're going to also need a yolk sac. So down here you can see a yolk sac. Or you're going to need a fetal pole. So here you're seeing a fetal pole. So you need a gestational sac and a yolk sac or fetal pole. In addition, this needs to be within the uterus, right? So you can see a gestational sac and a fetal pole outside the uterus in an ectopic. And then finally, it has to be not an interstitial pregnancy. So this is really not a common finding, but just something to think about. So not only should it be within the uterus, but if it's too close to the edge of the uterus, you should think about an interstitial. The measurement is 5 to 7 millimeters from the gestational sac to the edge of the myometrium. That will rule out an interstitial pregnancy.